Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, Michael Reynolds here with the Massage Therapy Foundation, and welcome back to Research Perch. I am the chair of the marketing committee for the Massage Therapy Foundation. We're online at massagetherapyfoundation.org, and Research Perch is a podcast dedicated to helping you understand current research in massage therapy. So I'm here with Nikki Monk and Ruth Werner. Nikki, how are you?
Doing well, thanks, Michael.
Excellent. And Ruth, you doing well today?
Just great, thanks, Michael.
Fantastic. Glad to have you both. So today's article that we're going to dig into, I really am interested in. It's from the IJTMB, which is the International Journal of Therapeutic Massage and Bodywork at ijtmb.org. And it's the positive effects of massage therapy on a patient with narcolepsy. So first dumb question for me. Ruth, what's narcolepsy? Just to make sure we're all on the same page.
Yeah, it's a great question, and it's a word that's easy to take apart. Narco means sleep. Lepsy means seizure. So narcolepsy means someone who has what looks like seizures of sleep. In other words, they fall asleep quickly and unexpectedly during the day, and that's often paired with really poor quality sleep at night.
Okay, great. Thank you for that background information. So Nikki, what happens here with this study? What are we looking at? What's the background on this study?
All right, well, this was a case report that was actually performed by a student massage therapist. So she was about halfway through her program, or actually more than halfway through her program, but she had a client who came in who was 23 years old. She's been diagnosed with narcolepsy for 5 years, and the big pieces for her is the excessive tiredness. She also has a lot of leg movement, random leg movement, and of course the falling asleep constantly, but really having lots of wakefulness during the night and excessive fatigue during the day. And so this student therapist, Robin Hill, provided 5 weeks of treatment once a week for 45 minutes each session. And what she used as her measurement tool was the Lead Sleep Evaluation Questionnaire, which uses 10 visual analog scales to assess things like sleeplessness, awakening following sleep, behavior following awakening, and getting to sleep, and quality of sleep, and the like.
Okay, so some good stuff in here, but I want to back up and ask one more dumb question. I'm just full of them. I said it was a study, and you said it's a case report. What exactly is a case report, and how is that different from other types of things in research that I might come across? Is that a dumb question, or can you help me understand that?
That's not a dumb question at all. And so a case report is an N of one, if you will. So there's one person that you're looking at.
Okay.
And so this particular case report was looking at one particular client and their outcomes. This was a prospective case report, which means that it was determined before treatment started, and that would be in contrast to a retrospective case report, which is when somebody looks back at hindsight at a treatment situation that they had and reported on those outcomes.
Set up in advance, basically.
Yes, but
Exactly.
But there's also. Did you want to talk about the difference between case report and case study, Ruth?
Well, no, but I wanted to make a slightly different point, Nikki.
Sure.
Which is that one of the really important things to understand about case reports is that they are not experiments.
Yes.
And that's another thing that makes a case report different from a study. So a case report is strictly observational. One of the things that is a defining feature is the therapist does what the therapist does, and doesn't interrupt the treatment series to see what happens, or doesn't do anything different than what they would normally do for any client. That might mean they try some new things, just as we would do for any client, but it means that we're not testing an experiment. Does that? I hope that's.
That really helps quite a bit, actually, and that's very helpful for me, and that kind of clears up some of the misunderstanding I had here. So case report is basically observing one subject.
Exactly.
Okay, fantastic.
In practice.
Yes.
Yeah, okay. Mm-hmm. Now, one question I had here is, and maybe I missed it, but it said there was 5 45-minute massage therapy treatments were administered. Does it say anywhere maybe what type of massage therapy, what techniques were used? Does that even matter?
Well, it certainly can, and actually, I don't recall offhand exactly, but I think that she was using primarily Swedish techniques.
Okay.
And because she was a student therapist, I think that that's a pretty safe. I wouldn't want to just assume that, but I'm not seeing the specifics on that.
Okay, so it might be that, like you said, it was kind of a relaxation-focused Swedish massage. That would be your interpretation based on what you know.
Well, actually, here, okay, so let's see. So each treatment began with reflex and fluid techniques, so primarily including rapid topodema, petrissage applied to the anterior and posterior surfaces of the legs. So it's using Swedish techniques, but not necessarily for that relaxation response.
Okay.
It appears as though she was doing more of a pepping.
Very specific work
stimulating
on the legs. Okay.
Mm-hmm.
Oh, because she's working for improved alertness daytime. Yeah,
Yep.
yeah, that makes sense. That's interesting.
Okay, great. So, so it looks like what I'm getting from this is there's, it's not necessarily something we can say with confidence. If a massage therapist says, "Hey, I've got somebody with narcolepsy," this is really a suggestion that it might help, but it says further research is needed. Is that fair? That you can't really necessarily say, well, research shows this is going to help. It's more of there's good signs that indicate that if you have narcolepsy, this type of massage therapy can help, but
Right.
It's not definitive, right?
Right, right. So this is if you're thinking of the evidence, if you're thinking of evidence being a pyramid, as far as research that's done in people, case reports are going to be right at that foundation. This is your causation cannot come from case reports.
Okay.
But it certainly does provide, and I think this author does a really nice job of even saying, in this instance, these massage therapy sessions helped this person with narcolepsy. So
Okay.
it suggests that it could be beneficial for clients with this condition.
So does this type of case report actually lead to further research? Like, is this an indication? Oh, someone's calling Ruth.
Yeah, I think that I have.
So does a case report like this indicate that it looks promising to conduct further research? Is that typically what happens now?
Yes.
Yeah, it could do. When I'll build on Nikki's description of that research pyramid. So case reports, which are essentially a formal way of telling the story. I have a client who. Are at the base of our pyramid, but when we have a bunch of case reports, or if someone, say, makes a specialty out of working with people who have sleep problems, and so they end up writing several on a similar topic, and we might call that a case series, that provides interest for people who might be looking for a larger scale or a more complex research question to ask. And so case reports, really interesting case reports, are often a trigger for the next layer in the pyramid, which is some level of preliminary research that might look like a pilot study or something like that.
So again, maybe another dumb question, but can our listeners who are massage therapists, can they do case reports on their own?
Oh, that's not a dumb question at all. It is. You know, my goal, and I'll speak for Nikki and say I bet it's her goal too, that most massage therapists who ever listen to this podcast and most who don't feel that they have the skills to write a case report. It is not an easy thing to do. It's not simple and it's not quick, but it is an astonishing way to learn a lot about how your hands matter to your clients. So a case report is as I've said, it's a story of this is what happened when I had a client who had this disorder, and these were the client's goals, and here's how we worked toward those goals, and here's what happened. You know, here's how it all turned out. Mm-hmm. When we have surprising things happen in our practice and we don't report them, they live and die in that little session room. And our profession can't afford to lose those stories.
Right. It's a very important opportunity for practitioners to make a significant contribution to the field. And the reason for this is because there's There are some case reports that are being done out there and some research that's being done out there, but not a whole lot of massage research is being done by massage therapists. And a lot of the massage research that's being done isn't necessarily looking at the massage that is practiced in massage practice or in the massage field. And while the massage techniques and utilizations that physical therapists, for instance, use and occupational therapists, for instance, use is certainly very relevant to our field, it's important that if our field wants to have a say in the discussion of the direction that massage therapy research is going, that the practice and the practitioners in the field have to start providing some of this foundation information to help direct it.
Yeah, this really interests me because it sounds like there's probably a lot of massage therapists out there with case reports just waiting to happen. They're just not documenting it. So, with the right framework, is there just a kind of a general framework that perhaps we could provide at the foundation, or maybe already do provide, that could give a practicing massage therapist the instructions for creating a case report, or should we write a blog post about that? Is that information out there?
Yeah, I'm actually writing a paper on that right now.
Okay. Okay.
That's right. I have a draft of your paper that Karen gave me to read.
Yes.
And the answer to your question, Michael, is yes. The foundation has already provided a lot of resources for people who would like to learn how to write case reports, and that's because we run 2 case report contests every year, one for people who are currently in school and one for practitioners. So on our website, if you go to the research button and then click on case reports, you'll find the guidelines that we have created that are, in my opinion, really strong, good guidelines for how to write a good case report. People can do it for the contest or not, doesn't really matter. But really the next step after having gone through all that work is to submit that case report for publication. Because again, if it doesn't get into the literature, it just sits in a desk drawer or on a hard drive somewhere, and no one ever gets to benefit from that. And so the journal, the International Journal of Therapeutic Massage and Bodywork, we publish case reports. There are a few other scientific journals that publish case reports. And it's critically important to form the base of our pyramid. But the other thing that case reports do that is, it's hard to overstate how much we need this, is that other healthcare providers are more and more often looking at massage to see what massage can do to help their clients or their patients who have sleep disorders or depression or injuries, headaches, whatever, life things. And they want to know what happens when a massage therapist works with someone in this population, and they have no way to know that. So because case reports are purely observational, they just describe what happens in this interaction, they're a tremendously important way for us to demonstrate what our profession is to people from outside our profession who are interested in what we do, to see if we're a good match for their patients as well.
This really interests me. So what I'm hearing is we need massage therapists, our listeners here, to learn how to create case reports and submit them, because that helps everybody, right?
Yes.
Yeah. And in addition to the guidelines that we've published and that are available for free to everybody, we also did a 5-part series webinar on all of the steps that it takes to write a case report. And as I said at the beginning, it's not a simple or quick thing, but it is definitely, I apologize, it is definitely within the skill set for any massage therapist to be able to do this.
Okay.
So I really encourage anyone who's interested in adding to our evidence base to take a look at that. We've made it as simple and as accessible as possible without making it, without oversimplifying it.
Yeah, sure.
Right. Well, and I think that this particular article that we have as our focus today is a really great example of a case report. Yes.
And it was a winner of our case report contest.
Yes, it was. And one of the things I also want to point out about this particular article is that there's 2 authors on it. And what this highlights is the fact that they did a writing team, and that there was an advisor that was helping this practitioner to write it. And I do believe actually both of these are winners. One was a past winner, and then this one was a recent winner, right?
Yeah.
So, right, and so really being able to identify partners to, perhaps the practitioner's writing is not, they don't feel very confident in that writing piece, or providing some of the other aspects, and linking up with either somebody who's in academia or somebody who does some kind of scientific writing is a really great way to move that along.
Mm-hmm.
Great. Well, we're almost out of time, so I do want to wrap up pretty soon, but I've got one more question I want to touch on here. And I'm noticing, I know it's just one subject and it's a case study, not necessarily definitive, but it looks like there's some pretty interesting results. It's noting here that this particular person improved getting to sleep by 148%, improvement in quality of sleep by 1,100%, an improvement in awake following sleep by 121%, and improvement in behavior following awakening by 28%. Now, one question I have here is, where do they get these numbers? How do you translate the quality of sleep, for example, to a percentage?
Really great question. And so this is really getting at how do you quantify this subjective information, if you will, right? And so what they've used is a visual analog scale, also referred to as a VAS. And for each of these different pieces, it's basically a 10-millimeter line, and they are asked where on this scale, on this visual analog scale, do you fall when at this extreme end it is the worst possible sleep ever, and at the high end of the scale it's the best possible sleep ever. And then they're able to put a tick mark on that line, and then when you measure that line, now you have that information quantified. So now if for example, the visual analog scale, they put that tick really close to the very left-hand side, and that indicates really poor, so it had maybe a 10. But then after the treatments, their tick on that scale is now at a 9 or 90. There's a 80%, wait a minute, did I just do my math right? 80% improvement.
No, 800%.
There we go. I was missing I was like, gosh, that doesn't seem like very much. No, it's 800% improvement. And so that's where you can get these 1,100% improvements on something like this. It really does indicate a really robust change for this individual person.
Okay, so you're taking their subjective feedback and giving them a visual way to represent that in an easy, kind of frictionless way, and that turns into the numbers we get.
Correct.
Okay.
Very important to remember in research that you can only do that, you can only compare those VAS scales within one person's feedback. In other words, my VAS scale cannot be compared to Nikki's.
Right.
Make sense? And that's a weakness that we sometimes see, is that people will try to take readings from one person's pain scale or whatever the subjective measure, whatever the subjective report is from one person, and try to compare it to somebody else's, and that just, that doesn't work. It's only accurate and valid if it's just you comparing to yourself.
Your 9 is not the same as my 9.
Exactly.
Right, but what you do, when you're looking at these kind of measures, what you're looking at is the change.
Right, the extent of change, right.
Right, so your 30% is pretty, you essentially are saying that your 30% change is close to what my 30% change would be.
At least comparable.
Yeah,
right.
comparable. There you go, comparable, that's a good word for that.
Okay, great. Well, we're just about out of time here, so this has been a really interesting discussion. I've really enjoyed kind of digging into this one, and a couple takeaways I want to wrap up with here that I really find exciting. And one of them is, even though it's not definitive, but massage therapists who are practicing can say to their clients, maybe with narcolepsy or sleep issues, say, hey, there have been cases reported of this type of massage therapy improving narcolepsy. You can't actually say, there's been evidence or research behind it. You can say that, there have been cases of this happening. Is that fair to say?
Well, it's certainly a case.
Yes.
Yeah.
Yes.
We're going to be careful and not overstate our claims. So,
exactly.
But that's pretty interesting. I think that's worth saying. I think that's worth noting. And the other thing I'm getting out of this is that I had no idea what a case report really was, and I don't want to say easy, but how approachable and accessible it is.
Ooh, what a good way to describe that.
Therapists to create a case report. Now, as you said, it's not super easy necessarily. It might take some work, but again, I can imagine there are massage therapists listening right now who have anecdotal stories of things happening in their practice and helping their clients achieve positive results. And if they were to put that into a framework and document it properly, they could submit case reports and get published and really help the industry and the community as a whole. So I find that really exciting. So I would encourage our listeners to think about that and submit case reports.
The other thing I'd add as a value add to this, well, there's two value adds. One is if people enter the contest and they win and they go on to be published, there's a substantial cash prize. But the other is if you publish in the IJTMB, this is indexed in PubMed, which is the largest index of medical science journals on the planet. And once you're indexed, once you have an article with your name in the author line on PubMed, the doors to publish again in other contexts or to get hooked up with other scientists are much more open. It really is a great gateway into the research world.
Well, and not just that. Think about from a business standpoint. You can tell your clients, hey, I've published case reports and they're in PubMed.
That's right.
I mean, how credible is that? I mean, that's incredible. So
well, and when you're approaching care providers, you can actually refer to your work. So if you did a case report on pain and you're going to a pain clinic, you can say, I have a case report here. They're going to be able to go to that PubMed, which is something that they do in their practice when they're doing evidence-based practice in their clinics, and they will be able to see that, and it certainly does validate them.
Find you. Yeah.
That's
I'll
wonderful.
add before we sign off, there is actually another venue for case reports. It's called Case Re3. CaseRe3.org is where you can find this. It's an international repository of case reports in the complementary and alternative medicine field. And the foundation partners with the producers for Case Re3. So it's another place to find this kind of examples of what we're talking about.
Great. We'll put that in the show notes as well on the blog.
Good.
Awesome. Well, thank you, Ruth. Nikki, thank you so much as well. This has been a really interesting discussion. I've learned a lot, and I hope our listeners are now very excited about potentially learning more about how they can treat narcolepsy with some of these examples, and also how to submit case reports. Really how to help the community and the profession and to help their own business by getting published and submitting these case reports. So I hope that has really helped a lot of people. So thank you both so much. Real pleasure, and thanks everyone for listening. And again, click below to subscribe if you're watching, and if you're listening, keep on listening and visit us online at massagetherapyfoundation.org. And you can read more about this specific article in the journal at ijtmb.org. All right, thank you both. Thanks everyone for listening, and we'll see you next time.
Thanks,
Next
Mike.
time.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.